Hello, I am Dr. Narendranathan. I am one of the gastroenterologists in the GG hospital. I am here to discuss the importance of the liver day. April 19th is observed as the liver day. And this is mainly to increase the awareness about liver diseases and also to know about the importance of liver in the human body. You all may know that the liver in an adult weighs about 1 to 1.5 kilograms and is situated in the upper part of the abdomen. And you know that we have got only one liver, but we have got 2 kidneys, 2 lungs, and so on and so forth. We have got only one liver. And the liver serves many important functions. One of the important functions of the liver is that it detoxifies material that are not needed for the body. For example, if you take a drug, some drugs are actually inactivated by the liver and is thrown into the bile. It also produces things like albumin for the protein in the body, produces prothrombin to preserve the clotting function of the blood. And it also secretes bile. This is also an important thing because through the bile, when the bile reaches the intestine, it helps in digestion. One of the important things that you have to remember is that the red color of the blood is due to hemoglobin. And when the red blood cells are about 3 to 4 months old, they die and they release this hemoglobin. This hemoglobin is taken up by the liver and it is converted into the yellow substance called bilirubin. So when the liver function is destroyed, when the liver becomes diseased, many a time it manifests as jaundice, mainly because this bilirubin is not excreted from the liver. So as the liver is involved in the excretion of bilirubin, the yellowish substance, whenever the liver becomes diseased, like hepatitis, or when there is a block to the flow of bile, we may get jaundice. So jaundice is one of the signs of liver disease. From here, I think what I would like to mention is about liver disease. I will be surprised to know that above the age of 25, if you take 3 persons, 1 out of every 3rd person may be having liver disease. And many of them are not aware that they have got liver disease. This is an important thing. And this type of liver disease is what is called the fatty liver disease. There are 2 types of fatty liver disease, one due to alcohol and the other which is not due to alcohol. And that which is not due to alcohol is called the non-alcoholic fatty liver disease. And this has become very common. It is estimated that more than 35% of people in Trivandrum, even up to 40% of people above the age of 25 in Trivandrum are having fatty liver disease. This is important because once you diagnose this disease early, we can control it, we can prevent its progression. And if it left without any treatment, without any interventions, you know that some of these cases in fatty liver can progress to become chronic liver disease. They develop cirrhosis and rarely even liver cancer. So this is one of the important things. So one of the messages that we would like to give in this liver day is that many patients with liver disease are not aware that they are having liver disease. So if you are a little overweight or if you have diabetes, it is essential that you should get your liver function test done and an ultrasound scan of the abdomen also done to find out that is liver disease. Fatty liver disease is there. It is important because if you diagnose fatty liver early, we have got interventions which can treat the disease. So after fatty liver due to non-alcoholic fatty liver, the other is definitely liver disease due to alcoholism. And the treatment and the way to prevent this is not to take alcohol. This is something that we should know. The non-alcoholic fatty liver disease which occurs due to overweight, diabetes and unhealthy food habits. Then how do we prevent fatty liver disease? The way we prevent fatty liver disease is by lifestyle modification. One is can take regular exercise, about 30 minutes a day and up to 150 minutes in a week. It is essential that you do regular exercise and you walk in such a way that you take at least 100 steps in 1 minute. So if you do this, and it has been shown that it can prevent fatty liver disease. And once you are diagnosed with fatty liver disease, it is essential that you go for regular checkup and follow the advice of the doctor. The next important disease that we would like to discuss is about hepatitis. Hepatitis means inflammation of the liver. As I told you, it can occur due to alcohol, it can occur due to viruses. Some drugs can also produce hepatitis, like drugs for tuberculosis, drugs for cholesterol, some antibiotics. They can all produce hepatitis. But one of the things I would like to mention here is about the hepatitis produced by viruses. The viruses are A, B, C, D, and E are the 5 viruses. You know that we have got vaccine for hepatitis A and hepatitis B. So it is essential that everyone has got is immunized against hepatitis B. We know that we have been able to bring down the incidence of hepatitis B dramatically because of the clean, safe injection practices, and then the operations and the procedures are done meticulously, making sure that they don't spread the disease. So hepatitis B, we have got a vaccine, and I advise that everyone should have hepatitis B vaccine. Hepatitis A and E are spread through water, and hepatitis A we have got vaccination. So hygienic practices, take good water, don't take and street foods are the things which can produce hepatitis A. Here I would like to mention one thing is that in the Trivandrum water supply, I have never seen hepatitis A or E in persons who have been taking water from the Trivandrum water supply. If I see a person with hepatitis A or E in Trivandrum, he has got the disease from outside. He has come from Bangalore, Delhi or Chennai, but not factoring in. So this is something which can be proud of, because we are giving good water to the people of Trivandrum. And the third is about chronic liver disease. We know that as liver disease progresses, it can even become cirrhosis. And cirrhosis, if left untreated, can even lead to cancer. So a person with chronic liver disease, it is essential that he gets for checkup periodically, and he should have an ultrasound every 6 months to know that he is not developing anything like cancer or anything. And if at all it is detected, it can be easily dealt with. So one of the things which I would like to say here is that liver is a very important organ. We have got very important diseases like fatty liver, hepatitis, and cirrhosis, and many of these can be tackled effectively. So let us make this day an awareness day for liver disease, and let us commit to better liver health and a healthier life for all of us. Thank you.